Scenario 5. A 52 years old male presents for his annual checkup with no specific complaint. His in-office blood pressure readings are consistently within the normal range. He has a family history of hypertension and stroke and mentions occasional stress and fatigue, but no significant symptom. He exercises moderately and follows a relatively healthy diet. Despite normal office reading, his physician is concerned about the risk of hypertension based on his family history and lifestyle factors. What further investigations could be help in assessing his true blood pressure status and what condition might be suspected? Yes, Professor Bilal Muhyiddin.
Assalamu alaikum ji. Before I go on this case discussion, first I'd like to thank Tariq Abbas and Kashif for inviting me for this good function, and indeed Fawad for conducting it so honestly with time precision. So it's indeed a challenge to be done, and well done. So please may I ask the House to give a full claps to these two gentlemen for doing a great work. I just went around the hospital, it was something lovely. Why I'm started off with this way of answering is because this is the vision of a doctor. The vision of a doctor has to assess what may go wrong with a patient. And the patient's going wrong has already been explained with this scenario where it says that the family has a hypertensive history, and then there is his health is a question, and the stroke is there. हम सब ने बहुत दफ़ा ये सवाल सिनेरियो देखा होगा जिसमें लोग आए कहते हैं कि जी बाबा जी को कभी इन्होंने एक एस्प्रो की गोली तक नहीं खाई, and suddenly he ends with a stroke or something like that. Since we are talking of masked hypertension, there was a study, since I had to go through this little bit of literature. So there are studies which is called a Quebec study, and there's another one which is called the Veronica study. And they are talking about the fact that a person who is not labeled a hypertensive, you do their ambulatory blood pressure monitorings, and then you come back and see what is happening. So they did about 1,100 plus cases of ambulatory blood pressure monitoring, and out of those 1,100 cases, only 26 were hypertensive, and 44 were masked hypertensives. Majority of those percentage went to masked hypertension. यानी कि ये वो लोग हैं जिनकी लख्त थोड़ी देर के लिए बीपी ऊपर जाता है और फिर ठीक हो जाता है. So at the age of 40, 52, 60,
इनकी अजीब बात ये है कि इनके क्लिनिक में ब्लड प्रेशर बिल्कुल ठीक होते हैं. So, अपने रूटीन सिचुएशंस में ब्लड प्रेशर बढ़ते हैं.
So जो दो तीन चीजें हम सबकी जिंदगी में हर वक्त होती रहती हैं, वो एक स्ट्रेसेस है ऑफ लाइफ, और जब आपके कैटाकोलामीन्स रिलीज होते हैं जिनको हम लोग उस वक्त इंपॉर्टेंस में नहीं ले रहे होते, एंड देन दे कॉज द सर्ज. और हर शख्स का अपना रिस्पॉन्स सिस्टम है, नंबर वन. नंबर टू, आवर सोसाइटी हैज गॉट एनवायरमेंटल इश्यूज लाइक स्मोकिंग, which smoking itself per se takes the heart rate up and the BP up. ये उसके एक फैक्ट्स हैं जिसके बारे में बात करना लोग पसंद नहीं करते, लेकिन दिस इज व्हाट इट डज. अच्छा, जो लोग पीते हैं ना सिगरेट 30-40, वो हर वक्त स्टिमुलेटेड हालत में रहते हैं, बट दे देन सडनली हैव एन ऑर्थोस्टैटिक ड्रॉप ओवर देयर. बट जो लोग कभी चार दोस्तों के साथ बैठ के यकलख्त आके उन्होंने सिगार टका लिया है और उन्होंने काम अपना खराब कर लिया, and there are things which help over there which worsen over there. किताब सारी जिस किताब को भी उठाएंगे ना सर, खास तौर पे आपके लिए, जिस किताब को भी उठाएंगे हर किताब ये कहेगा रिड्यूस एल्कोहल, कोई ये नहीं कहता स्टॉप एल्कोहल, बिकॉज उनकी इंडस्ट्री डिपेंडेंट है इस बात पे. एंड रियलिटी इज यू हैव टू स्टॉप द एल्कोहल एंड स्टॉप दोज हैबिट्स. सो कंडीशंस व्हिच कैन सडनली एलिवेट योर ब्लड प्रेशर, दे आर व्हाट टू बी डन. अब जाहिर है इसमें सवाल ये है कि जी हाउ यू इन्वेस्टिगेट दीज पीपल. ऑफ कोर्स इट्स एन एम्बुलेटरी ब्लड प्रेशर मॉनिटरिंग टेक्निक, बट ही डज एक्सरसाइज ऑल्सो. Since he does exercise, so the trick is that after exercise, take his blood pressure. He should have an automatic blood pressure, because once you're doing that, you may find out that his blood pressure shoots out of proportion of the exercise. जैसे कि हम लोग ETT करवाते हुए कहते हैं ये 220 हो गया, इसको नहीं करना आगे ETT, ये गड़बड़ में जा रहा है. उसी तरह से you might find out over there. These masked hypertensive patients, nearly 50% of them later on will become hypertensive patients. So ये वो early stage है, जैसे कि आप डायबिटीज़ के बारे में कहते हैं ना कि ये अभी प्री हाइपरटेंसिव है और ये कल को हो जाएंगे, तो ये उसी तरह से चीज़ें लाजमी नहीं कि होंगे, बट 50% ऑफ देम डू बिकम, एंड दिस इज़ वेयर वी नीड टू पिक अप. एक चीज़. दूसरा, you have to sit down with them and explain to them that since you have a family history of hypertension and stroke, so you consider yourself as pre-hypertensive, even if you are 110/70, consider it this way because you will be protecting yourself. बिल्कुल उसी तरह से जैसे कि आप कहते हैं ना कि जी एक शख्स को डायबिटीज़ हो गई है तो उसका हार्ट का केयर इस तरह से करो जैसे कि उसको फर्स्ट हार्ट अटैक हो चुका है. तो उसी तरह से जिनकी फैमिलीज में ये चीज़ें पड़ी हुई हैं और वो अभी हैं नॉर्मल, ऑफ कोर्स दैट डज नॉट मीन दे हैव टू बी ऑन मेडिकेशन, दैट ओनली मीन्स लाइफस्टाइल मॉडिफिकेशंस एंड एज फार एज द सॉल्ट्स एंड इनटेक. और एक वो सॉल्ट्स की बात बीच में डिस्कशन में आई थी. इफ यू डू योर सोडियम चेक and your sodium is below 135, then there is no point in reducing sodium, because now you are actually liable to go into hyponatremic side effects. Yes, but if you are on having a sodium level of 150, then you need to curtail and everything. और फिर उसमें अगला सवाल आता है कि how much potassium you need to take, because potassium also is a thing which helps you out. So potassium की correction उसको आपने ऊपर लेके जाना, provided there is no renal issues, provided there is no other compromising problems. You are laughing. I know you're about to touch the renal issues over there.
That's the beauty of Dr. Bilal. He has so much knowledge that he move around from his topic to everywhere.
Yeah.
So from mask hypertension to sodium to potassium, but these are important things.
These are important
to be
because
discussed.
this is how we do
the
it.
crux of this scenario was that all those who are high risk for having hypertension don't just rely on their clinic blood pressure. You have to have 24-hour ambulatory, especially for high risk. Any comments? Yes.
I think, Fawad sir, just before comment, integrative omics कल हमने जिक्र किया था, इसका बड़ा रोल है predicting disease ahead of time, जिसमें proteomics, genomics, metabolomics. I think these are the research areas where before happening any condition, you anticipate a condition. तो इसका एक बड़ा रोल है. डॉक्टर प्रोफेसर बिलाल साहब, any idea of yours about these things, because this is very common condition where all the family members are hypertensive and you fear of the condition developing in future. A lot of research still is going on of diagnosing these conditions ahead of time.
एक डॉक्टर शहबाज को भी माइक दे दें जरा.
Nicely.
ये मुमकिन. अच्छा, सारा के पास already है. Let's quickly just.
Nicely put up.
Dr. Bilal, first you conclude.
Nicely put up. It's all in genomes at the moment. They're working on it, and of course, one hopes, and that is where the whole research is all about: that predicting a disease and making you genetically strong enough you don't get it. But rest assured, you do something, something else will creep in.
Yes, Sarah.